What are you looking for when you see a mammogram? I know we have a 3D image we'd like to show our viewers, and talk to us about exactly where they're looking and what exactly they're probing into.
Sure. So as we discussed a little bit before, when you're getting a mammogram, basically what it is a black and white x-ray of the breast tissue in compression. So the radiologist will compress the breast from top to bottom and then side to side, and they're compressing the breast tissue and taking an x-ray and looking for several things. One, they want to compare year by year and make sure that there's no changes. So unless this is a first-time baseline mammogram, there should be prior images to compare to understand whether or not there's been a change from the prior year. That's the most important thing. They're looking at the anatomy of the breast. They're looking for symmetry, basically between the left breast and the right breast. So if there's a large mass on one side that wasn't there previously and it's obviously not symmetric to the other side, that is something that would stand out. Additionally, they're looking for microscopic changes, little white dots called microcalcifications. That's really the earliest signs of breast cancer that can really show what a stage 0 breast cancer looks like on a mammogram. They're little white tiny dots. And those microcalcifications can represent the earliest stages of breast cancer. If it's a large mass seen on a mammogram, that's sometimes easier to see. And even on ultrasound or other modalities, or even by examining the patient. But what you're really looking for on a mammogram is the very beginnings of breast cancer, which are sometimes microscopic findings that you cannot feel. This is an anatomical diagram of the breast tissue, and it's not exactly representative of what we see on the mammogram because this is kind of more of a detailed anatomical drawing. But what you can see here is up here is the pectoralis muscle. That's the red muscle right there, and you can see that on the mammogram. You can see sort of a faded white outline of that. This is the glandular breast tissue here, and this is the tissue that we're taking a good look at under mammography. The nipple is right here. You want to look for any evidence of nipple inversion or nipple asymmetry. And then these green little dots over here are representing lymphatics and lymph nodes. You can get a visualization of some of the lymph nodes under the arm on mammography, depending on how deep the mammogram image goes. But ultrasound is also used as an additional adjunct to look at the axilla, because sometimes you can't get a very good detailed look at the axillary lymph nodes on a mammogram.